Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Okay, welcome back to part 2 of my episode, How to Lower My Risk of Cataract and How to Protect My Vision. My name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. Thanks for tuning into part 2 of this episode today. You can find all of our episodes for free wherever you listen to podcasts, or just go to our website, invitehealth.com/podcast. There's almost 500 podcast episodes up there. Please subscribe and leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And the information on this part 2 of this episode is linked at the episode description. So let's get back to it. Let's finish up here. In part 1, I gave some recommendations on how to prevent cataracts, including food. Now let's look at some nutrient studies. This is JAMA Ophthalmology, Journal of the American Medical Association Ophthalmology. Lutein and zeaxanthin for the treatment of age-related cataracts. It's part of the AREDS-2 study. So it's through the National Eye Institute. That would be part of the National Institutes of Health down in Bethesda, Maryland. And they said age-related cataract is a leading cause of visual impairment in the United States. The prevalence, this is scary, the prevalence of age-related cataract is increasing. I guess that's because so many people are reaching their 70s, 80s, and 90s today, and even 100. So that's going to be just a natural part of that. So people were randomly assigned to placebo, which is a fake pill. We used to call it a sugar pill. Lutein and zeaxanthin, 10 milligrams of lutein, 2 milligrams of zeaxanthin. Fish oils, a gram a day, or a combination of the lutein, zeaxanthin, and fish oils to look at the effects on developing age-related macular degeneration, which is the number one cause of blindness in aging people. Here's what they found. The 5-year probability of progressing to cataract surgery if they didn't give lutein and zeaxanthin was 24%. So if you didn't take lutein and zeaxanthin, you had a greater likelihood of developing cataracts to the point where you need cataract surgery. For lutein zeaxanthin versus no lutein zeaxanthin, the progression to cataract surgery reevaluated, it was real. It was real. 32%. It was real. So that's JAMA Ophthalmology. Now, this is the journal Nutrients. This is a more recent study. It's June 2020. Lutein supplementation for eye diseases. It's the Department of Ophthalmology, the University of Hong Kong, the Department of Ophthalmology, Boston Children's Hospital, Harvard Medical School in Boston. And here's what they said. Lutein is one of the few xanthophyll carotenoids. That's a type of carotenoid. They're pigments found in fruits and vegetables. They do a number of things. They act as sunscreen. A fruit or a vegetable can't move out of the sun if it's 110 degrees. They release these pigments to protect them. But they also attract pollinators. They do a lot of things. And they do the same things for us, by the way. Lutein is an orangish yellow pigment. And you find it in green leafy vegetables, like I mentioned before. You find it in spinach and broccoli. You find a little bit in pistachio nuts. You find it in egg yolk. So that makes an argument for eating an egg once in a while. So they said lutein is one of the few xanthophyll carotenoids that is found in high concentrations in the macula of the human retina. That's like a shield. The macula not only is responsible for fine vision, you have the fovea there that looks like an egg yolk that's responsible for fine vision, but it also blocks bad things from getting into the retina and destroying it. So lutein can only be obtained from food. Well, now you could get it from supplements. It's a natural substance abundant in egg yolk and dark green leafy vegetables. And it's an anti-inflammatory, it's an antioxidant in the eye, and it helps prevent or alleviate eye diseases such as age-related macular degeneration, which can make you go blind. It's the most common cause of blindness in people over the age of 55. Diabetic retinopathy. And diabetic retinopathy, the little blood vessels in the back of the eye are bursting and breaking and creating scar tissue. And you start to get little globs of fat in the eye that stiffen. It's called hard exudate. So it's pretty nasty. About 80% of diabetics at the 10-year mark, if they don't take care of their diabetes, develop diabetic retinopathy. So the lutein and zeaxanthin help protect you from the most common cause of blindness, macular degeneration, and diabetic retinopathy, and myopia, which is true. There was a very fascinating study about 3 or 4 years ago. They found that in people who study in college and for a PhD in law school and medical school, etc., that they develop nearsightedness, they develop myopia, because they're inside when they should be outside. So they found that there's a real correlation between staying in college and graduate school for many years and developing nearsightedness. So they were giving them vitamin D to see if they would prevent it, and they found out quite by accident that lutein prevented nearsightedness in like college students and grad school students. So that was interesting. So it helps prevent myopia. But according to Harvard here, they also said it helps prevent cataracts. And they said it's very safe. So why not take it? So here's the American Journal of Clinical Nutrition, January 2019. Dietary vitamin and carotenoid intake and a risk of age-related cataract. So they're looking at the diet. It's the School of Public Health in Xi'an, China, and the University of South Australia, and a couple of other academic research institutions. And they said existing studies, dietary vitamins and carotenoids are associated with a reduced risk of developing cataracts as you grow older. I'm paraphrasing. So they used 8 randomized controlled trials and 12 cohort studies in a meta-analysis. Now, a meta-analysis puts together studies that you judge to be well-designed, accurately reported, and lacking bias. So when you put them together, you get a much bigger population, you get a lot more researchers, a lot more data. So usually if a meta-analysis is done correctly and honestly, it proves something either works or it doesn't work. So they did a meta-analysis. Now, if it's a cohort study, that's a huge population. So this must be millions of people. 12 cohort studies and 8 randomized controlled human clinical trials. They said most vitamins and carotenoids were significantly associated with a reduced risk of age-related cataracts in the cohort studies, including beta-carotene, a 19% reduction, vitamin C, a 20% reduction, vitamin E, a 10% reduction, natural beta-carotene, 10% reduction. So vitamin A was the other one, 19% reduction. So let me go through that again. I apologize. Vitamin A, a 19% reduction. Vitamin C, a 20% reduction. Vitamin E, a 10% reduction. Beta-carotene, a 10% reduction. But lutein and zeaxanthin, 20% reduction. I mean, there's real meat on the bones for lutein and zeaxanthin protecting the eyes as you grow older. So let's go to the next page of the study. And cohort studies, the risk of age-related cataract significantly decreased by 26% for every 10 milligrams a day increase in lutein or zeaxanthin intake. So every time you got 10 milligrams of lutein or zeaxanthin, it reduced your risk of cataracts by 26%. By 18% for each 500 milligram increase in vitamin C intake. Now, you know, there's a lot of fruits and vegetables that have more vitamin C than an orange, like cayenne pepper, but that's too spicy. Red peppers, the red bell peppers, the green bell peppers, mangoes, kiwi fruits, broccoli, they're loaded with vitamin C. You can get vitamin C from these natural things. It's not like you have to pop pills all day, even though I sell pills. By 18% for each 500 milligram increase in vitamin C intake. But let me just tell you this. Always spread your vitamin C throughout the day. If you take 500 milligrams of vitamin C, most of it is absorbed, and it lasts for about 6 hours. But if you go to 1,000 milligrams of vitamin C, percentage-wise, less is absorbed. Even though you're absorbing more than 500 milligrams, you might only absorb 700 milligrams, and it only lasts for about 4 hours. So the higher you go with vitamin C, percentage-wise, the less you absorb and the shorter it lasts in the body, because the body doesn't want all that acidity. So you spill it out in your urine. So the best way to soak yourself with vitamin C is 500 milligrams 3 times a day with meals. That would be the best way to increase your vitamin C levels. If you're diabetic, they don't utilize vitamin C very efficiently. So for a diabetic to saturate them with vitamin C, I would give them 1,000 milligrams 3 times a day with meals. So that's good advice. By 8% for each 5 milligram increase in natural beta-carotene intake. By 6% for every 5 milligram increase in vitamin A intake. So they actually put a connection between the amount of a nutrient you take and a risk of cataract. And it shows you that this is real, that the more you get of a nutrient, the lower the risk of a cataract. So here's Xi'an University College of Medicine in China, but they're looking at lutein and zeaxanthin. It's a meta-analysis of a bunch of studies, how much will lower the risk of cataract. So they're finding an actual connection between higher doses and lower risk. So some lutein and zeaxanthin lowers the risk, more lutein and zeaxanthin lower the risk even more. So it's 6 prospective cohort studies identified. Significant inverse association for nuclear cataracts by 25%, for cortical cataracts by 15%, and for posterior subcapsular cataracts by 23%. If you take in more lutein and zeaxanthin. And they showed for each 300 microgram per day increase in the intake of lutein and zeaxanthin, there was a corresponding 1% reduction in the risk of, 3% reduction in the risk of nuclear cataract, 1% reduction in cortical cataract, and 3% reduction in posterior subcapsular cataract. So once again, they're connecting the amount of lutein and zeaxanthin to a lowered risk of cataract. And they said just for 300 microgram increase in intake, which is a tiny, tiny amount, you actually had a 3% drop in the risk of developing the most common cataracts. So that's real. That's real. Do I need to do any more of these? Maybe. Why not? This is the journal Nutrients. 8 different studies were analyzed. Same deal. Zeaxanthin lowered the risk of cataracts by 37%. Lutein lowered the risk of cataracts by 27% if you had a lot in your blood. But that's the thing. They were looking in the blood in this study. They were looking in your blood. So that's real proof. They're not depending on people reporting how much foods they ate. They were actually looking in the blood. And here's the last one I'm going to read you. Critical reviews in food science and nutrition. Can zinc supplementation mitigate diabetic complications? And the answer is yes. Zinc lowered the risk of a number of issues, especially with the eye, including the formation of cataracts. So here's the take home. If you're going down to Florida in the winter, or you're going on a cruise, or doing anything pretty cool like that, I really would wear shades, sunglasses, that block ultraviolet radiation. Not all shades do. You want to block ultraviolet radiation, because that really does increase the risk of a cataract. You don't want to smoke. Smoking is really a big cause of cataracts. It really destroys the eyes. If you have diabetes, get it under control. Keep your drinking down. For men, less than 2 drinks a day. For women, less than 1, because that leads to cataracts. Alcohol's a solvent. Alcohol is a very tiny molecule. It passes the blood-brain barrier, a barrier that protects the brain and gets into your spine and brain very easily, and it creates toxins that can affect the brain and the eyeball. You don't want to see pink elephants, and you don't want to develop cataracts. You can eat an egg every day, but eat the whole egg. Eating egg white omelets is so 1970s. Don't do that. It'll cause problems, like it'll lower your biotin, and then you're going to lose your hair, and your blood sugar will go up. So have the complete egg, and this way you get the ingredients, such as the lutein, the zeaxanthin, the zinc, and the vitamin A, and the riboflavin that are very good for your eyes. Eat green leafy vegetables, such as spinach and broccoli for the lutein, but also for the vitamin C content. And you might want to take an eye supplement if you're older, because as you grow older, it gets harder and harder to absorb lutein and zeaxanthin from food. It gets harder and harder to absorb zinc from food. You also need zinc for your immune system and many other things. You also need lutein and zeaxanthin for your memory. So I would, after the age of like 55 or 60, I would start taking one of those vision formulas, but make sure it has natural lutein and natural zeaxanthin in it. So thanks for tuning in to the Invent Health Podcast today. You can find all of our episodes for free wherever you listen to podcasts, or just visit inventhealth.com/podcast. Please subscribe and leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. Hope to see you next time on another episode of the Invite Health Podcast. Thanks for listening. Jerry Hickey signing off.